I'm going to talk a little bit today about breast or chest compressions. This is a great free tool that you have. You never have to look for it because you always have your hands. You don't have to buy it. It's free. And this can be something that really makes a difference with the amount of milk you're able to collect in the bottles as you're pumping, and also the amount of milk that your baby's actually transferring when they are having a feeding. So this is great for babies who are premature or have any sort of oral anatomy issues like a tongue tie or an ability to latch. So if those things are affected, they're probably not transferring as much milk as they could be or should be. So using these compressions, it's really a great way to kind of give them a little bit of help with that. So what we're gonna do is we'll latch the baby in really any position, but you wanna make sure you have a hand available in order to do the compressions. So I'm just gonna use cross cradle, supporting the baby behind their ears, kind of near where the jawline connects to the back of the head. And I would hold the breast in my hand, make a little breast sandwich, one of my favorite latching techniques, and just latch that baby on. That's a whole other video. And at this point, you would kind of feel around for any areas of fullness. And as the baby's drinking, you're just gonna really squeeze and give that a really firm compression. So we can do this all the way around, just feeling for those areas. You can reach in between and squeeze there. And really all the way back up and towards your armpit, there's ducts. So you can even be pushing back towards here if it's not too tender. Another way that we can use this is with pumping. So I've got my hands free bra on. I'm going to pop those flanges in. Obviously they'd be connected to tubing, but I'm just kind of pretending. And this way you have both hands available to really do those compressions on each side. So I'm just going to kind of reach around again, feel for those areas of fullness, give it a good squeeze. Move all the way around, even like underneath and again up in the sides. And really just give it a nice firm pressure. Again, no bruising, but try to get as deep as you can while it's still comfortable. Doing this while you're pumping, you can yield 30 to 50% more milk during a pumping session if it's done well, which is like amazing. So it can really help up our supply because the more we empty, the more milk we're going to make. And you know, we're gonna be able to collect more milk, which if you are struggling with supply at all, huge bonus.